Thank you so much for your time again. And you just mentioned that you are from Poland. So I'm wondering, where did you move here and where did you study medicine?
Well, I moved here in 1963,
Mm-hmm.
and I went to college here. And then I studied medicine here at NYU.
Mm-hmm.
And I did all my training at NYU, and I stayed in New York for my practice. I did go to Colorado for general surgery, though.
Mm-hmm. Yeah, wow, interesting. So you're a New Yorker. You went to college in New York and you
Yeah,
practice in New
well,
York.
when you come to this country, most people come to New York because
Yes,
it's like a melting pot,
exactly.
So we came to New York, and at that point, I went to college. I didn't know about colleges all over the U.S. I just knew
Mm-hmm.
about New York. And
Yeah.
then when it came to do medical school, I stayed because I got a full scholarship.
Mm-hmm.
And then when I did my surgical residency, I went to Colorado because I thought it was beautiful there.
Yeah.
And I did my general surgery studies there. I enjoyed skiing, and I used to be on the ski patrol, and that was
Uh-huh.
much fun.
Wow.
And then when I finished with the general surgery, I went to do plastics in New York. So
Mm-hmm.
I came back, and then, my family was here. I already had a child by that time. So it helped a lot.
Absolutely. And you mentioned you got a full scholarship. That's very impressive because it's not easy to get a scholarship to medical school. What were
Well, you're
your,
right. You're
yeah.
right. Especially back in the 1960s.
Mm-hmm.
And was accepted at Harvard, but they did not give me a scholarship. So I went to
Uh-huh.
NYU. So
Wow, that's amazing.
that's what
And
that.
why did you decide to go into medicine and especially into plastic surgery later on?
Well, I'll tell you, medicine was a universal field. So I knew that no matter what I did in life, I could always practice it and work in it.
Mm-hmm.
And so I always thought that if I wanted to travel and live elsewhere, I would like to do medicine.
Mm-hmm.
I also enjoy the incredibly wonderful relationship you have with your patients
Mm-hmm.
and the people. And in those days, it was almost an intimate relationship where people really trusted you.
Mm-hmm.
The other thing is you achieve something every single day. You help someone, or you change their life, or you came across all kinds of conditions, whether it's people or whether they're disease.
Yeah.
And it was a wonderful time that when you went home, you knew that you did something important. So I like
Absolutely.
that a lot. Yeah.
Mm-hmm. And how long have you been practicing plastic surgery?
So when I finished general surgery, it was a very pivotal time in surgery at that time and in
Mm-hmm.
medicine. I went into general surgery first, and you learn all the general stuff like gallbladders and
Yes.
uh, hernias and all that. And then what happened? Breast cancer became a field that interested me a lot. And at that time, you didn't have very good mammography, you didn't have MRIs. And so very often the breast cancer was pretty advanced and the resections were huge. And the question was, how do you fix someone's chest after, or how do you reconstruct a breast?
Yeah.
Um, and it was a huge challenge at that time because a lot of patients had radiation therapy and the tissue was not very healthy. And so microsurgery began to develop where you could transfer healthy tissue from elsewhere
Mm-hmm.
and connect it to the blood vessels in the chest to give someone a healthy chest and cover the defect. So when that happened, of course, I had to have the newest challenge. And so I decided to do a fellowship in microsurgery. And to do that, I had to go at that time into plastic surgery to do the basics. And I did a lot of breast reconstruction by the conventional method. But I was able to take a fellowship in microsurgery. It was the beginning of microsurgery, which means a free transfer of tissue from other parts of the body to the affected area. And so at that time, I was at Bellevue, and we were the team where we transplanted limbs and fingers and, of course, breast tissue. So it was a very exciting time, and I could not resist it. So I wound up in plastic surgery.
Wow, it's an interesting journey. And what kind of procedures do you offer right now?
Well, I have to tell you, that was a long time ago.
Yes.
And by the time I went into practice was 1982, and I was doing microsurgery at that time. And as I got older, younger people started doing the microscope work, and I began to do general reconstruction, whether it was cleft lip and palate, whether it was hand reconstruction, general facial reconstruction, and vaginal reconstruction. And later on, as time went on, we all change our careers within a career. And so I started doing more cosmetic surgery. It gave me better hours. And I enjoyed, I began to understand how appearance or looks affect people psychologically. And it was a big step for me, because I realized that if someone was born with a deformity or uneven breasts or huge nose or whatever that bothers them, they would probably be very shy and rather than successful. So I started enjoying that. And then on my journey, I realized that women, especially once they start going through menopause, have a lot of vaginal problems, and I started concentrating on that. So throughout my career, I always search forward to the newest and whatever interested me, and medicine gave me that opportunity.
That's wonderful. There are obviously so many changes in medicine nowadays, technology advances. How do you feel about all the changes?
Well, some I embrace. I embrace the wonderful technology, the diagnostics, the less invasive surgery, the earlier detection of cancer. Those are wonderful, wonderful advances. I enjoy the advances in anesthesia, where it's so much more safe, where a lot of things can be done on an ambulatory basis. People don't have to be admitted. So the safety and the diagnostic and the treatments have come a long, long way. But there are other changes in medicine that I really don't like so much. And one of those is the incredible paperwork that involves today in performing medicine. And it takes so much time out of patient care and speaking with patients and having a good relationship with patients. So I don't enjoy that very much. The huge number of regulations also causes people to have a huge overhead, because you have to hire more and more people to be able to fill all that paperwork and all the new compliances. And so that changed a bit. I think that the old-fashioned way of being someone's doctor was a very, very nice relationship. And that is changing nowadays.
Wow, interesting. And obviously you have a very demanding career and you're a really successful woman. Do you have time for your family, and how do you balance everything?
Well, that was the one thing that was extremely, extremely difficult. because back in the 1960s, when I decided to go to medical school, I was looked upon by other women as being, being strange, because it was so demanding, and how were you going to have children? But again, I figured I can do it all. So I got married and I had two wonderful children. And it was very difficult. You had to put different hats on when, different hats on when, excuse me for 1 minute. You had to put different hats on when you're with your children, when you went to work. You couldn't think about your children when you're at work, and you couldn't think about work when you're with your children.
Yeah.
It was difficult, and it was, I did not know whether my kids are going to be fine. I did not know how it's going to affect them. But I did know that there are many children that grew up without a father or without a mother, who have done well. And I thought that if you love your children and you're with them when you're with them, and you secure them when you're not with them, that it should be okay. And so my kids grew, and they were okay. And my daughter followed my footsteps, and she does now plastic surgery, has a very successful big career. She actually started doing microsurgical breast reconstruction, just the very place I started 30 some years ago. And that is extremely satisfying. And she also has 3 children, and she manages the full career and the children.
Wow.
And my son went into business and is extremely successful working on Wall Street. And they seem to have thrived. So I guess I got vindicated.
Wow, that's impressive.
Yeah.
Amazing family. So when you look back and you were so busy with your career, do you regret anything? Would you want to change something if you could?
Well, I'll tell you, I love my career. I do. I do miss having more time off or a more fun social life. But you have to put it in a balance.
Yeah.
For me, the career was very satisfactory. At that time, medicine was extremely exciting, and the relationships you had with your patients and your colleagues were wonderful. Today, when the medicine is changing the way it is, I don't know whether I would do it again today. I probably would have more of a job, maybe in public health or in some form of medicine, medical field, but it would be more of a 9-to-5 job, so that I can have more time at home. The relationships with your patients for the young doctors today are hard to develop. And so I don't know what satisfaction they will have from their career. It's a different world than mine was. And I'm just watching it with curiosity.
Yeah, absolutely. And I'm wondering, what difficulties do you still have running your own practice, and how do you manage to run a successful practice in New York when it's so competitive?
I think one way you do that is like in any business. You take care of your customers. You take very, very good care of your patients. You provide them the best and a very, very smooth surgery and recovery. You're upfront and you're honest with your patients, and you try to do your best. None of us are gods. We're just human beings, and we try to do our best. So I always had good communication with my patients because I enjoyed that immensely. So the other thing is you always have to change with the times. You can't keep doing the old thing you've done 30 years ago. You have to learn new things. You have to take courses. You have to take continuing medical education. You've got to see what's new. You want to see what people are talking about. What is it that they want? What is that you like? What can you learn that will help the people who are coming to your practice today? So as long as you are open-minded and you're willing to learn, change, and educate yourself, you're going to do okay in any business, not just in medicine. Absolutely. So I think that's probably one of the secrets, or the not so secret, path to success.
That's great. And what would be your words of wisdom, your advice to women that wants to run a successful career?
Well, it's a difficult advice to give. It depends on the person's personality. The woman who really, really would like to have children and spend her time with the children and feels that she would like to participate in the children's activities in school and be the primary caretaker, I would say get a 9-to-5 job with less stress so you can have an open mind and a clear mind when you're with your children. For the woman who feels that she has an opportunity and she doesn't want to miss it, I say go for it, because you'll always regret. You can always change your mind and quit or change to a lesser career. But don't give up in anticipation that perhaps it's not for you. So, like anything, depends on the person, what they expect out of life, what the expectations are, what makes them happy, what satisfies their needs. So it's very, very individual. So that's my advice.
Thank you so much. Is there anything else you would like to add about your career, medicine, and overall women's success?
Well, I think that women have become quite successful. And sometimes they're so successful that they have difficulty marrying men. Because they sometimes are more successful than their counterpart. So one has to think about that as well. I think that there's more to life than just success. I think you have to balance with family life, with your children, with your friends, because friends are extremely important, as is family. And so one has to make time for everything. I've been lucky. My children were healthy. My marriage has been good. My husband was very supportive. And I was able to do it all. But it is very difficult and it is stressful at times.
Wow. Thank you so much, Dr. Helen. Thank you.
Thanks. Thank you.
I'm through with you.